keep hearing about these asymptomatic cases of COVID-19. Those are the people with the virus who don't show any symptoms.
This is a big reason why the CDC started recommending wearing face masks in public. So how many asymptomatic cases are out there? Heather, this is sort of the scariest scenario, right?
Right, absolutely. These so-called silent spreaders of the virus. And early on, even as late as mid-February, the World Health Organization was saying we thought that these asymptomatic cases were pretty rare. But if you look at the studies now, there have been a couple that have been done. The CDC is saying about 25% of the positive cases could be asymptomatic. Some other studies out of Japan and China say 30%. Dr. Fauci said over the weekend 25 to 50%. But then he went on to say that is just a guess. We are taking a stab in the dark. Even the people on the task force don't agree on those numbers.
It's interesting because, and I suppose actually tracking transmission of a disease is very challenging, right? Especially when we are social people, you encounter a lot of different people. Did you get it from someone who was asymptomatic? Did you get, who knows, right?
And in fact, if you remember the Diamond Princess, that was that cruise ship where the people were forced to stay on that ship in Japan. They actually were able to do almost a mini science experiment because they were able to test everybody on that ship.
Sure.
And on that ship, they found that 18% of the people who tested positive were asymptomatic. So they actually could use that ship as a good place to start some of this testing.
Of course, the question is, just because there were people who were asymptomatic, it doesn't mean that they're spreading it or not. So my understanding was that this is mainly spread through the cough.
Right.
Like the cough is the number one way. So how does someone who's asymptomatic, well, first of all, does everyone agree that the asymptomatic people are spreading it?
No, that's the assumption that's happening now. But it is hard, as you mentioned, it's hard to do this research and do this really intense observational research.
So we don't really know.
We don't really know. But what we do know is these people do have the virus in their noses, in their throats. So we know that they have it. So the idea is that they would be shedding it. And it doesn't just have to come from coughing. Those droplets don't just come from coughing, and this is not sneezing so much with this virus, but studies have shown that they believe it can come from singing, from speaking, from sitting close to someone. We keep hearing about sort of that 10-minute time period, that close personal contact. So the idea is that there are people out there that could be spreading it without even knowing it.
Yeah, I know there was a choir in Washington State that had huge spread, and no one, at least the reports anyway, is that nobody was coughing. But when you sing, you're really putting a lot of gusto in it, right?
Or even speak, or
So now what? What do we do with this information, right?
Exactly. And so what the policymakers do with this information is if you remember, probably about a month ago, all they were saying was anybody who's sick, stay home.
Right.
That's changed now. Everybody stays home now. The face masks came out with the CDC saying, look, we don't know how many asymptomatic people are out there, but if they are and they're shedding this virus, wearing a face mask can help because it stops the droplets from getting out of that person. You know, the face masks, and we've talked about this many times on this show, is the face masks are really protecting the people that are around you.
Protecting everybody else.
But the big thing is these antibody tests, those tests that we've talked about as well, the ones that happen after. Were you exposed to the virus? Did you have the virus? And until we get those antibody tests, it's going to be hard to figure out how many people are actually asymptomatic.
Sure.